I'm a Harvard-trained cardiologist that practices in Burbank, California and Santa Clarita, California. I see my patients are really benefiting from RESPeRATE. It has absolutely no contraindication, no side effects, so there's no downside to it. I first found out about RESPeRATE when I was doing research for my book, Your Vibrant Heart. I was looking for natural, non-pharmacological ways to address hypertension. And I liked RESPeRATE because it really tied in my belief that stress is a big component of hypertension. And any tool that allows your body to downregulate and reduce stress, and that can allow you to incorporate mindfulness and being present in the moment, was basically a win-win-win situation for me. I wrote my book, Your Vibrant Heart, Restoring Health, Strength, and Spirit from the Body's Core, as a roadmap or a guide for patients to get back to their true inner state. I like to say that the book and the content of the book came in and through me. And so in other words, I wrote this book, and this book and its content then became the manifesto and a roadmap to how I changed my practice from what initially was a very Western form of practice to the current practice now that integrates so many of the Eastern arts into my practice, into health. You know, I always am intrigued by technology. I'm always intrigued by tools that will help a patient get to the end goal. Okay? And so when I talk to my patients about doing practices such as yoga or meditation, the biggest objection that I get, or the biggest complaint that I get, is for patients tell me, well, one, I don't have the time, or number two, I can't do it, I can't be still, I can't still my mind. And so with RESPeRATE, it is a very easy tool that almost takes that self-directedness that a patient has to have when they need to sit down and do meditation or do breath work with yoga, and it makes it very sort of rudimentary in a way. Breathing and the control of the breathing, and particularly extending the expiratory phase, downregulates the autonomic nervous system. So it's really putting a halt on that whole sympathetic parasympathetic balance, increasing your parasympathetic, lowering your sympathetic, lowering your heart rate, and then your blood pressure. Now, I know that a lot of patients will oftentimes come back and say to me, well, that sounds simple enough. You know, why can't I just do that on my own? Why can't I just take a stop clock or a watch and control my inspiration and expiration? And I tell my patients, you know, try it, do it, and you'll find that it's actually much harder than you think. I think RESPeRATE is special because it has data behind it. There are 10 clinical trials to date. Half of them are randomized control studies that looks at the benefits of RESPeRATE in patients with hypertension. So the data is there, and that I like. I like that the FDA has cleared it as the only non-pharmacologic methods for lowering blood pressure. My patients are really enjoying their experience with it. I think it's easy to use. I think the time investment is something that most people, even if they have a very busy day and busy life, can do. And most importantly, they're seeing the benefits. The main reason I recommend RESPeRATE is because it is effective. It is a tool that helps patients to control their breath work, that lowers their stress, that lowers their blood pressure.